direct SAMHSA to develop and implement an outreach and education strategy to promote mental health in our Latino, in our language, in our community's sensitivity, and would further identify gaps in access during this pandemic, and of course, reduce stigma. This legislation will reinforce the message, and there is absolutely no shame in asking for help. That's what we sometimes are all too shameful. Next, I have 2480, the Immigrants Mental Health Act. We need to address the mental health conditions at the border. Less visible is the internal suffering those individuals have as they come to our border. They have endured trauma in their home countries on their long journey, and then only to be further traumatized at the border. But thank God we have a new administration which is pledging compassion, dignity, and respect. But we must take action to right those wrongs. 2480 would develop a training curriculum for the Border Patrol agents to identify mental health warning signs in immigrants and help them. Prevents federal government from sharing their confidential mental health therapy notes. There are very many bills in Congress being proposed, and you can access them anytime by visiting our Mental Health Caucus website, mentalhealthcaucus-napolitano.house.gov. Also in my district, I have a mental health consortium led by Dr. Irma Elisheva Diaz, who does a marvelous job in bringing together the professionals, city officials, first responders, education officials, and others to advocate and share information on a regular basis on mental health policy and other related issues. We need additional mental health hospitals and clinics. Please stress that to people that you know, and ask them that where are the hospitals that we used to have to put mental health, critically mental health people, and we need to partner with the federal, state, and the county to treat the incarcerated and others with serious mental illness. Our work continues. It cannot and that must not be limited to Congress. I encourage all of you to get involved. Continue to educate your elected officials on these very important issues and share your knowledge with friends and family. Talk about it. If you must, start your own group to talk about mental health. Pretty soon others will join you. You'd be surprised. Then if you see someone who has fallen on hard times, help them out and refer them to mental health services. The National Suicide Prevention Lifeline is 800-273-TALK, T-A-L-K, 800-273-TALK. But together we can strengthen the mental health well-being of our communities and eventually live in a world where there is no stigma. I thank you very much, and I wish you a lot of success in this endeavor. Bless you, and have a great meeting. I have to leave. I have another commitment right now.
Congresswoman, I want to thank you on behalf of all the mental health community for all the wonderful that you work. And I will make the announcement for tomorrow, Facebook live event with also Congresswoman John Katko and also Dr. Phil. Again, un abrazote from the camera, a big hug. Take care and have an excellent day, okay?
Gracias.
Thank you. I think she's right on in all the issues that we have, not only, again, more than ever, our communities, not only the Latino communities, we have a huge impact in this pandemic. I think the immigrants' mental health is something that, again, the access has to have the ability in order to respond to the demand that we have. And today, again, with the experts that we have, you will have a lot of good information. So be ready for this morning. And this is a good segment in order to present the first speaker for this summit. This is somebody that I know for many years, a good colleague, a good friend, but also a good mentor for many people, not only myself. It's a truly honor and pleasure always to have the opportunity to introduce Dr. Sergio Aguilar Gaxiola from UC Davis. He's the director for the Center Reducing Disparities Program. So Sergio, you're on, the floor is yours.
Thank you so much, Luis. Can you hear me?
Yes.
Great. Well, the pleasure is mine. I was so much looking forward to this meeting, and I want to thank you, Luis, for your extraordinary leadership, and also to the team that made this possible. Blanca Padilla, I see Richard Saldivar, a great, great friend, and many other friends. You know, Teresa, I'm seeing you as well. And it is The only thing that I wish is to see you in person, but it's going to happen a little bit down the road. And but it's truly a genuine pleasure to be with all of you. And Luis, you continue on that tradition that you started more than 2 decades ago. And your leadership is so much needed, especially now that we are, in the middle of the pandemic still, and the tremendous mental health impact. So let me start it. I'm going to share my screen. Please be with me. And what I'm going to do is, actually, can you see the screen?
Yes, yes.
Thank you, Luis. I'm going to put it in a slide show mode. Can you see it?
Yeah, you're ready to go.
Thank you. Actually, Luis asked me if I could do 2 things. And I know that it's ambitious, but I will try to do it. One is to speak a little bit about, what is happening to all of us, and especially the most vulnerable populations in terms of the mental health impact of the pandemic. And also, if I could give you an update on what I had been speaking with Luis's convenings, for years, that it is like a family for me, and I have shared with you the progress that we had made in a very unique, in many respects, innovative project that we had been involved for about 5.5 years. And I'll give you an update about that project as well. So let me get started. And please notice that this is before COVID-19, and at that, before COVID, actually, there were pervasive structural inequities for Latinos. This is a slide that was given to me, and I'm in the National Advisory Council of SAMHSA, Center for Mental Health Services, and they provided these and other slides. And this is just to bring to your attention for Latinos. This is treatment gaps that are very, very pronounced. Just to center you a little bit, those who have, this is back in 2018, and these are Latinos, actually 18 and plus. I know that it says 12, but it's 18 and plus. So those with any mental illness, 18 and plus, about a little bit, about 2/3 had no treatment. But the one that is an eye-opening is this one right here. Of those with co-occurring any mental illness and substance abuse disorders, 93% of Latinos receive no treatment for this condition. This is before the pandemic. I think that is worse now with the pandemic. So please keep that in mind, because one of the challenges that we Latinos have faced for decades is the lack of access to care and utilization of services when we need them. So let me go very quickly to something that is sobering for me. I saw this excellent article in the LA Times when we got here in the US to the milestone, a sad one, that there were 500,000 dead. I'm sad to tell you that right now we are getting close to 600,000. And in California alone, there are about 63,000. And in Los Angeles, where many of you are, it's about 24,000. Do you know how many people that is? And that is remarkable. this is massive loss, massive grief that our families are going through. So let me share with you. This is at that time that California accounted for 50,000 deaths. Now it's 64,000, and nearly 20,000 in LA. Now it's 24,000. And which, look at these numbers, where about 1 in every 500 people has died. And I was impressed with this particular quote in that article. You see that number, and it's not just another number, said Bettina Gonzalez, 39, whose 61-year-old father, David Gonzalez, a popular football and basketball coach, died in August. It's a lot of tragedy that goes behind the number. And just to give you a sense of how this has been playing out throughout the pandemic, look at these numbers. The mortality ratio is 4 times higher for Latinos and 2.5 higher for African Americans than the COVID death rate for whites. But if we peel this, dissect this or stratify this in a more granular manner, the mortality ratio for the foreign-born Latinos, many of us, 20 to 64 years old, with high school or less, is 11 times the COVID-19 death rate for whites. And this is primarily due to workplace exposure. We are, many of our communities are essential workers that have, by necessity, been exposed to, contracting the virus. That has been the reality. A great proportion of the population in California hasn't had the luxury to stay at home like I have. So that is an important piece to keep in mind. The other thing that I want to bring to your attention is that the risk of death from, for example, food and agriculture is 39 times higher than for the overall population 18 to 65. And we have been focusing a lot of work on farm workers in my center in collaboration with many community-based organizations. And farm workers are likely to be even higher than the rest of the sector. And of course, with this massive loss of life, there is a mental health burden that includes grief to the families, co-workers, friends, and neighbors. There are a lot of widows and a lot of widowers and a lot of grandchildren without their grandfathers. And that's the reality that we are facing. And I think that it's important that we have a reckoning with that. The other thing that is important is to understand that the impact of COVID-19, it is just not at the individual level, but at the family or household level and at the community level. So look at this excellent article by the New York Times. The grief crisis is coming. And what they document is a study that shows that for each person who dies of COVID-19, experts say there are at least 9 newly bereaved. 9 people. This is like ripple effects. And so there is a lot of grief, of bereavement in our communities right now. This is another sobering paper at the end of the last year in December. And they were doing a premonition that the second wave of devastation is imminent. And this is related, once again, to the mental health consequences of COVID. And the magnitude of this second wave is likely to overwhelm the already frayed mental health system, leading to access problems, particularly for the most vulnerable populations. O sea, nosotros. En buena medida, nuestra comunidad. I want to share this with you. This is from an English epidemiologist who came up with this very interesting diagram or portrayal of what he considered the four waves of the pandemic. I won't concentrate on the first wave or second wave or third wave, but he's not a mental health expert, and yet look at what he anticipated already with the fourth wave, that is going to be characterized by psychic trauma, mental illness, economic injury, because those things are very much related, and burnout, health professional burnout. That is already happening big time. The other thing that I want to bring to your attention, by the way, is this is a busy slide and got a little bit out of whack. But what I want to really focus on is that we need to focus when it comes down to the mental health impact to youth, because they have been badly hit with a triple whammy of a truncated education, a diminished job prospects. Teenagers, many of them get summer jobs or, to make un poco de dinero so they can buy a car or they can buy, a PlayStation, whatever they want to buy. But that is not happening by the most part this year. Also, reduce social contact con los amigos. The other thing that I want to bring to your attention, this is mental health impact of young people with a history of mental health problems. So those who had a history of mental health problems, about 81% agreed that the pandemic made their mental health much worse or a bit worse. So that is bad news overall, things that we need to consider and be aware of. The other thing is, once again, the loneliness, the anxiety and loss that comes with that massive loss of life. And the quote is that the crisis has hit children on multiple fronts. Many have experienced social isolation during lockdowns, family stress, a breakdown of routine, and anxiety about the virus. School closures, remote teaching, and learning interruptions have set back many at school. That's going to be the theme, and is going to hit us very, very hard. Some parents have had job and income losses, creating financial instability. Some even have lost have been evicted from their homes. And this, of course, compounds the parental stress that they already have. So thousands of children have lost a parent or grandparent to the disease. This is, a very much cited survey from the CDC that was released last year. And what I want to bring to your attention is that the increase in those youngsters, 18 to 24-year-olds, who have considered suicide in the past 30 days. And guess who are most affected with these suicidal thoughts and possible behaviors? Latinos, and as well as essential workers. Also, substance abuse has increased. I already mentioned that there has been a significant increase on either anxiety or depression or both, and the level of stress is as I haven't seen it before. One thing that I want to also mention is that during the pandemic, depression has increased threefold, which are all signs that we need to be paying attention to and come up with solutions. This is a remarkable article in the LA Times that has brought me to tears. I have read it several times, and it is very sobering for these reasons. Let me share a little bit from the article. The students' families, undocumented and first-generation Americans, essential workers, and people of color have been disproportionately hit by the ravages of the pandemic, losing jobs and contracting the virus, according to school counselors. They typically find custodial jobs, construction work, or fast food restaurant work. And I have been following the numbers, and I can tell you that these essential worker jobs are the ones that have been hit the most with mortality, excess mortality. But working 20 to 30 hours a week has taken a toll. Between his job and watching his two younger siblings, it's hard to master the motivation for academics, especially after a long work shift. He often feels drowsy and sad. In December, he was failing most of his classes. And this is Luis, that is being described in this article. And then Luis says, if I'm being honest, sometimes I wish I could just relax and be a teen, just to be a kid. But the level of responsibilities that they have been thrown at is just very, very sobering. Another thing that I want to that comes from that particular article is something that we are just facing already, and this is going to hit us harder. This is Antonio Roque, a counselor at Community and Technology School, said that the teenagers he works with had been thrown into the world of adult responsibility by coronavirus hardships, and they are in survival mode. They're just doing what they need to do, he said. I think we are going to start seeing the mental health consequences of this. The trauma surface when schools reopen. Actually, this is already happening in some schools that have been open. And I think that the teachers will have to do a lot of mental health counseling and deal with lots of crises, because this is coming. Here, what I want to bring to your attention very quickly, if I may, is that we had been with the Oversight and Accountability Commission and the Department of Healthcare Services Behavioral Health Division, and also with UCLA. UCLA is taking the lead on this through California Hope. If you haven't heard about that, I would strongly recommend that you look into it. But I want to very quickly share with you that there are resources that I would strongly recommend that you take a look at it. And if I'm allowed, I'll play very quickly this very short welcome that is happening, for the people who visit this particular.
Bienvenidos.
Bienvenidos.
Bienvenidos a Juntos por Nuestro Bienestar, una herramienta que nos conecta a recursos para apoyar nuestro bienestar emocional.
Cualquiera puede utilizar esta página web.
Y todos los enlaces e información aquí son elegidos por personas como tú y como yo.
Por lo tanto, nos conecta con recursos que otras personas encontraron valiosos.
Algunos están en la web y otros pueden ser descargados a su teléfono o tableta.
Hay información sobre COVID-19 en 40 idiomas.
Videos y aplicaciones gratuitas para ayudarnos con la ansiedad.
Meditaciones para aliviar nuestro estrés.
Actividades para ayudar a nuestros hijos a incrementar resiliencia y manejar su estrés.
Consejos para lidiar con nuestras emociones después de perder a un ser querido por COVID-19 y mucho más.
Todos están invitados, individuos, padres, familia, incluso trabajadores de la salud.
Le invitamos a explorar el sitio web y por favor, haga clic para darnos algunas ideas. Agradecemos sus comentarios.
We call this website Juntos por Nuestro Bienestar. Y lo que pueden hacer es ir al website. All you have to do is to Google Together for Wellness or Juntos por Nuestro Bienestar, CalHope, that is under CalHope, and you will be able to navigate this. By the way, in addition of having this in Spanish, we are also working on having this in Mixteco, maybe Zapoteco, but indigenous languages that are of critical importance for us. Now, if you allow me, I'm going to shift a little bit of gears here and share with you, bring you up to speed that many of you, I see several familiar faces within the, the videos, the little Hollywood square that we are now playing. And I know that some of you have been following this, and I'm delighted to share with you, this particular project that has been advancing health equity in access to mental health services for migrants, but that includes Latinos, of course. And very quickly, what I'm hoping to do with the rest of this presentation is to introduce to you again a model that we call the interdisciplinary collaboration and cultural transformation model. This is being funded through the innovation component of MHSA, of the Mental Health Services Act. I'll just speak a little bit about the three CBO partners that we have been working for the last over 5 years. Also, a little bit of improvement, quality improvement or action plans. I'll tell you a little bit of the preliminary outcomes, which I'm very happy to share. This is something that I haven't shared before. And then what's next? What are the next steps? So let me start here. This is, we're working in Solano County, right here, within California. And as far as I know, Solano County has been the first county to design a multi-phase innovation training and transformation project that combines the cultural linguistically appropriate services standards with community engagement. And what I want to just focus is that we are working with Latinos, Filipinos, and also with LGBTQ groups. When we started this, before we started with this project, the leadership from the Solano County Behavioral Health Division, Halsey Simmons and Leticia Cruz de la Sala Cruz, and several others came and spoke with us. And they said, for the last several years in Solano County, Latinos, as well as the Asian and Pacific Islanders, had been underutilizing services. There are problems with access to care. And in spite of the efforts that we have made, we haven't made too much of a progress. So the penetration rates were lower than the other groups that you see here, Native Americans, whites, and African Americans. So that was the situation that they presented us with. So this prompted the beginning of this model that you can see in the screen. Once again, we call it the ICCTM model for short. And it focused on the three priority populations that I mentioned to you. It has been anchored. We have been using the national recognized cultural linguistically appropriate services standards. And once again, it is the first of its kind that we are aware of, combining class standards with community engagement. This is basically what the model is about. There are three different phases in the model. The first one was a comprehensive needs assessment, cultural needs assessment. The second phase was a training or the intervention. And then the third phase, which is where we are right in the middle of, is the implementation of quality improvement plans and sustainability as well, because we're going to be leaving by the middle of this coming week. And in some ways, we will continue. And I'll tell you a little bit more about that. But that's what the model about. And this is what we have done. We started in January of 2016. And in that time, what we did was to collect stories, histories, and strengths of the Filipino Americans, Latinos, and LGBTQ communities. And you have here all the things that we did in terms of key informal interviews, focus groups, community forums, identified the challenges, accessing the Solano County behavioral health system and came up with solutions. Actually, they themselves came up with solutions. And we developed community narratives that are available for anyone that you want to, that want to see that. One thing that we did very consciously right from the beginning is that we had an evaluation that began when the project began and has continued until now. In 2017 to 2019, we trained people, and the trainings were in different manners. You know, train a lot of the personnel with on cultural competency, and also provided trained the trainers for some of the personnel. But the main intervention has been that we trained 54 Solano County residents and professionals that develop actually not 10, but 14 quality improvement action plans. And the evaluation continued during those years. And this is where we are now. You know, there are 14 quality improvement or action plans that in a minute I will share with you some of them. This is the evaluation framework, by the way, that we have used. During phase one, the tools that we develop and the indicators within those tools. And on the phase two, these were the tools again and the indicators. And this is where we are now, the tools and the specific indicators. We are documenting widely each of these three phases. So if you're interested, we'll be happy to share that with you. This is in terms of the goals. We have primarily three main goals. One is to increase community engagement and with the partnerships, which we have invested quite a bit of effort on that. Increase awareness of mental health services to decrease stigma. We have been using also the quadruple aim, which is increasing consumer experience, increasing consumer outcomes, increasing provider satisfaction, and diminishing per capita cost. And the ultimate thing that we have been looking for, this is the impact truly, is to increase access and utilization. Have we moved the needle in terms of those three populations of focus if they have a greater access and utilization? And of course, the delivery of the class-informed care. These are the partners that, the community partners that we work with and continue to work. Solano Pride Center, Fighting Back Partnerships, that is focusing on Filipinos and Asian and Pacific Islanders. Solano Pride with the LGBTQ population. Rio Vista Care, who is focusing on Latinos. But all of them, you know, see any client regardless of their background when they need services. This is, by the way, in a nutshell, the curriculum that we created. This is the training, and the training is very intense. It's 4 sessions of 4 hours each. And as you can see here, the first session is about an overview and on health disparities. Second session is on community needs and gaps. Third session is when we introduce the class standards. And between the 3 and the 4th sessions, the participants start developing action plans, and we provide quite a bit of assistance on doing that. And by the 4th session, they already have a quality improvement action plan. And then the fifth component is that we provide coaching for about 8 months in order to start implementing the action plans. These are the 14 quality improvement action plans that the participants And by the way, the participants were not only county employees and community leaders coming from these three communities of focus, but also representatives from churches, from schools, social services, law enforcement, transportation, etc. So it was very comprehensive and countywide. So we have these 14 action plans. There are 5 community focus. There are 4 that are defined by the community-based organizations that participated in this. 2 on workforce focus and 3 with a training focus. This is just, I won't stay too much on the description, but this is the action plan by Rio Vista Care, and that is supporting the Latino community. 2 goals, raise mental health awareness in the Latino community and enhance community outreach and engagement efforts through lots of things that they did. We just had a week ago the last community forum 3.0 with Rio Vista Care, and it was in Spanish, by the way. This is with Fighting Back, a little bit of that action plan, how it looks like, which are some of the highlights and achievements and the lessons learned. This is with supporting the LGBTQ community with Solano Pride Center. And also, there is an action plan to bring together, the various LGBTQ members that come from different ethnic and racial backgrounds. This is another action plan that they decided to call it LGBTQ plus ethnic visibility. They created incredible posters that are now being located strategically in different places in Solano County, and they have QRs, in the poster, so they can, through their iPhones or the phones that they have, to be able to get connected to the services. This is a fantastic one. I'm very excited with this particular action plan, taking class to the schools. And this is remarkable because during the time of the implementation of this particular action plan, there has been 35 wellness centers funded on school campuses in Solano County, K through 12 and adult ed sites, 5 pilot sites. And look at the furniture. This is furniture that came from the project. And the youngsters are the ones who select how those wellness centers are being furnished. I'm very excited about this particular action plan, especially because of the data that I just presented to you and the need to be focusing our efforts on youth. This is another one that the participants call themselves True Care Roadmap. It is a very colorful map, very thoughtful, with the different services represented in the map, and we have them in English, Spanish, and Tagalog. And the reverse of the map has a lot of phone numbers and contact information that people can go to. This is another one that we call ICU, to train frontline reception staff. With Latinos, when we access mental health services, up to 75% don't return for a second time. And it is because of the experience that they have as they walk into where the services are provided, and how the receptionist or the frontline staff, greet them, and how they feel embraced by the whatever the services are. This is another one, cultural game changers, with some of the. This was meant, by the way, to put it in the water of Solano County in terms of including in the job postings. They change job descriptions, etc. And there is this Solano County inclusion statement that is now in each of the hiring posts that are being done. So now I'm getting into the outcomes. First, I want to recognize that there were unanticipated outcomes that happened over the course of this project. One of them that we all experienced is the immigration concerns in the previous administration. That we were treated like piñatas, in many aspects. And just to give you an example, the public charge threats that really decreased the access to care because, the fear that people had about using public services that would work against them. Also, the attempted rollback of Don't Ask, Don't Tell and same-sex marriage, and the racial unrest in 2020. We all have experienced that. And more recently, the targeting of the API community with increased fear, anxiety, and depression, the hate attacks that have happened. And of course, the COVID-19 during these 15 months, an abrupt transition to telehealth, this impacted the implementation of several of the quality improvement plans. Some trainings had to be canceled and retooled to virtual platforms. There were virtual community meetings rather than in-person meetings, and there was a hiring freeze and no intern or career pipeline during this past year. But this is where we are. This is from 2016, when we got started. I'm happy to tell you that there has been an increase in utilization of services even though it looks like modest, both for Latinos and Asians, this is working towards a cultural change within the Solano County Behavioral Health Services. Also, consumers serve increased for both groups, 17% for Hispanics and 8% for Asians. And this is very concrete. This is comparison of calls to access lines requesting services from those years that you can see there. There was a 106 increase in Asian American callers and 87% increase in calls to request services, 525 increase in those who identified as a gender other than male and female, and 765 increase in callers who identified their sexual orientation something other than heterosexual. In Latinos, there was an increase of 34% to the access line. A few other things just to finish with this is I want to emphasize the importance of community engagement. Once again, we had been using right from the go in this project this framework for sustainability purposes, and also we are proposing and working with the Oversight and Accountability Commission. Both Luis and Richard are members of the Oversight and Accountability Commission Cultural Competence Committee, and so let me tell you that in terms of the sustainability of the cultural and linguistically appropriate services, these are some of the things that we have been doing to modify the county contracting practices. I already mentioned a little bit about that, to really work on policy development, and this is being impacted as well, to continue with the implementation of quality improvement plans. We have been working systematically on the hiring and retention, and doing something for those who are bilingual, by the way, in terms of salaries and in terms of other incentives. Working on diversity and equity plans, and there is an equity planning committee, and also with the interpreter and translation services. This is basically the last slide. Now, that we are at this point, what we're hoping is to, there has been requests from other counties, at least to know what we have been doing with Solano County. So there is this learning collaborative to provide trainings. There are 27 counties that are interested, and this is what we are planning to do with them. A curriculum of 10 different specific topics, and on community engagement, we are going to dedicate 3, because the experience that Solano County had was absolutely phenomenal in terms of community engagement. And we are also creating this mentor model in which Solano County, given the experience that they had, that they are in the process of selecting 3 counties that are interested in being mentored. One of them is LA County, by the way. So I'm gonna stop here. I'm going to stop sharing the screen. And Luis, I don't know if there are questions. I went through very, very quickly, Luis, and friends and colleagues, but I would love to hear some of the questions that you have. I hope that in my mind, what I did was to provide what is the mental health impact of the pandemic at the beginning, but then the question is what the health systems are going to be doing in order to adjust for these incredible challenges that we have, especially for the kids and the youth. One thing that I want to let you know is that just last week, the governor's May revised budget, it has, and I think that I share it with you, Luis, and others, is that it has an initiative to invest $4 billion, this is with a B, on a children and mental health youth initiative, which is remarkable, the kind of things that are being proposed, and that I would love that as many of you as possible, that you get involved, as we shape this, multi-billion-dollar initiative is shape up. So, Luis, let me stop there, and I don't know if there is time for questions, and I would love to hear, some questions that some of the attendees have.
Yes, thank you, Sergio. Thank you so much for all the information that you provide. I think it was amazing, the 2 components. One is the psychological impact, and again, all the communities, but in this specific case with Latinos, I think the other one is you and I, we talk about the good outcomes that you have in Solano County. And my question, and I know that in the committee that I belong with Richard Saldiva and other colleagues, which is the Cultural and Linguistic Committee, is a possibility that you can use this model within Solano County and other counties. I think, again, with these outcomes, always I say, if something is working well with all the communities, why we don't implement it, why we don't use this specific model. I know there's some proposal in the state of California, including Los Angeles County. Can you add a little bit of this possibility?
Yes, Luis, thank you for asking that question. And by the way, thank you for your service also, the Oversight and Accountability Commission, to you and Richard. I think that the involvement of leaders like you is so important, especially now, given the formidable challenges that we are facing. I provided you a very summarized tour, a very quick tour of where we had been and where we are, and also where we're hoping to go. And the Oversight and Accountability Commission, which is the funder basically of this particular project, and this comes from the innovation component, money that is given to the county, but it's a kind of a pass-through. The OAC, right from the go, almost when they started to see some of the outcomes became very interested, Luis, and you and I have discussed that. And now that we have not only these outcomes that I presented to you, there are other outcomes that we are about to finish with the reports. And they are very promising, let me tell you. For example, something that I didn't present here is that through the implementation of the action plans, there has been a significant improvement in timeliness of services. So the time when people request services, access the services or access the calls, the time has been reduced significantly. That is a good outcome, because it is not strange to any of us that if we are, sometimes I have come across cases in which there are people with suicide plans and even attempts. And when they try to get into services, they tell them, well, we have a spot in a month and a half or in 3 weeks. I know that this is happening. So that's that increase in the timeliness of services is of critical importance. Another one is that there has been a significant increase also, decrease of crisis counseling services, because people are accessing the services in a more timely manner. Correct. They don't have to wait until they are falling apart, to come for services. That has been a welcome outcome as well. And there are other outcomes that would love to, if I'm invited again, Luis, once we have everything that we turn, all the reports, that we will, present those outcomes. This, Luis, just very quickly to respond your question, we have been sharing this with the Oversight and Accountability Commission, actually throughout the project, and now they are very supportive, as you have seen, on having this brought up to scale, with the appropriate tailoring. Because, of course, whatever is happening in Solano County, it may not be happening in other counties. So that's why this idea about the mentor relationships of how, if there are specific counties, like as I understand, LA County and Orange County are interested in that. And there is at least 2 other counties, but we have the capacity to very closely working with Solano County to mentor, these counties. Actually, Solano County has a lot of lessons that they have learned. And I want to also recognize that I have worked with many counties, and I think that it's important that I recognize that Solano County has risen to the challenge, because even though at the beginning, when we did key informal interviews and focus groups and community forums, there were several things that people reported. I mean, hard feedback that we gave to the county and that we documented. And they took it. They were not defensive about it. And I recognize that to the county, good for them.
Correct. Thank you, Sergio. Thank you so much. I think make a big difference when the county has an open mind in order to improve the system and learn. We know that our system needs to innovate. I think the world changed with this pandemic, and I think it's important to have these people in the top level to open mind and listen new strategies, new ways in order to do business. I have another question for the chat is, you mentioned that 75% of people, they don't come back, after the first visit. You and I, we know that also sometimes they access the services and they do the same thing, 30, 60, 90 days, and they don't come back. Yeah. Meaning the engagement, the quality of care is a big issue. So right. It's a few very, similar questions in the chat. Mm-hmm. Can you add a little bit of these questions, please?
Yes, Luis, and thank you for to all of you who shared those questions. Yeah, there are studies done at the beginning of the 2000s. You know, there is one by Maccabi that shows that in the case of Latinos, those who finally get into the doors of service don't up to 75 don't return for a second time. And there are other studies that show, for example, the work that Maggie Alegría has done nationwide, that, you know, in terms of service utilization, the median number of visits, the mode number of visits was one, you know, one. And I have spoken with many people to realize that we have at least two challenges to deal with our mental disorders. And one is to have access to care, you know, timely access to care for those who need it. The second one is to utilize the services, but utilize them in a way that is going to be helpful. And what is related to that? Well, we know that many Latinos, when they come to services, if the services are not spoken in their language, if the services are not provided at a time when they can really use them, including the weekends, if the services, you know, are when they come to the reception and they don't see any signs, any indication that they are welcome, you know, and they don't treat them well, they won't return. Even, you know, I have seen cases in which people who are seeking services and they take two buses, that if they get to the service, to the appointment, 10 or 15 minutes late, they are not seen. And do you know what happens? They would never return, you know? Yeah.
Thank you. Okay, we have another question from Imelda Padilla. Imelda, can you unmute yourself?
Hola, Imelda.
Go
Qué
ahead,
gusto
Imelda.
verte.
Hi, Sergio. Nice to see you.
Yeah.
It's been a long time. Thank you for that wonderful presentation. It was very insightful. A lot of great information. Just you're phenomenal in all the work that you do. I was curious about one of the slides you showed where there was like this huge uptick in utilization of the call-in services for the Filipino community, the LGBTQ community, but it was much lower for the Latino community. And I was just wondering, did you have any insight into why that was or what happened?
Yes, we have some insight into that, Imelda. The county, if I remember correctly, they had a very charismatic Spanish-speaking bilingual, you know, she wasn't the ethnic services manager, but she served like that. And then there was a transition. She had to leave. And there was also another transition. And I think that, you know, some momentum was lost there. And the other thing is, you know, I share with all of you the unanticipated outcomes, you know. One thing that happened during the past administration, starting in 2016, that people didn't want to use services. You know, the public charge had a chilling effect of people not venturing, even when they needed the services, because of the fear that they wouldn't be able to get their papers. You know, and when the public charge was never really implemented, you know, just the fear. I remember that at the national level, there was a decrease of 1% in access to care in kids. And kids were safe, you know, and yet, you know, there was a reduction on you know, insurance for the kids, Latino kids. And those were indicators for us that we were working against, because of the threatening environment, a hostile environment. And thank goodness, let me tell you what a difference a few months make. Now, last week, we had the visit of the new Secretary of Health, Javier Becerra, in Sacramento. And I had the pleasure, truly the pleasure, to accompany him to a couple of community visits, a La Familia Family Center, primarily Latino, and also the St. Paul Missionary Baptist Church, primarily Black American or African American. And what I saw is amazing because there is a leader there, one of ours, who listens. I mean, he listens to people and makes them feel comfortable, embraces them, respect them, treat them with dignity, and is not coming to tell them what to do. He's there to ask, what can we do? We have resources. Tell us what to do, get organized, we will provide resources, and we will come up with the outcomes. What a difference it makes, Imelda.
Thank you, Sergio. Thank you, Imelda. Also, Javier Becerra made the announcement that he wants to increase the budget for SANSA $3 billion to specific with children's mental health and substance abuse. This is something that Sergio shared with me, so I share with everyone. So I asked a lot of questions regarding the PowerPoint presentation. Yes, will be available. We will email to you guys and some of the questions. We have a lot of questions, but like always, we don't have the time in order to answer all the questions. Sergio, on behalf of all the attendants, on behalf of all the community, the mental health field, we really appreciate all the work that you do for our community and other communities. Always is a pleasure to have you, and I hope you can come back. Thank you so much. Un abrazote con mucho cariño. Take care of yourself. And again, God bless you, Sergio. Thank you.
Luis, I'm the one grateful, let me tell you, because all of you, starting with you, Luis, are familia. No? I feel this warmth. And boy, every time that I participate in the meetings that you have organized with your team, Blanca, and many others, I come with a big smile and feeling hopeful, and here you are, bringing us together again. So thank you, Luis, for all that you do. And thank you all, because you do so much.
Thank you. I was planning to say that, Sergio. I think this is the whole team, is not Blanca or I, the speakers. I really, really, again, appreciate all the audience. Many, I recognize a lot of names, a lot of faces, and that's the difference. You say very well. It's the familia. We are the familia. We have the same mission. We work together. Maybe sometimes we have different views, different lenses, but end of the day, we want to do the same thing. We want to work for the community. We want to help people. We give you a hope. So we are part of the team. We're the familia. And again, thank you so much, Sergio. God bless you. Take care. Before we go to the next speaker, I would like to do a quick exercise. And the exercise is only 1 minute, okay? And this minute, again, based on what Sergio said, the familia, we plan to probably share with everyone. There we go. Somebody start moving, right? We have already almost 1 hour, 15 minutes. But in order to say hi to everyone, in order to have a little bit of energy, how about if we do this, everyone together, with all the people, and it's to have energy, because the next speaker is amazing, and Alex Capello does the same thing. Maybe for 10 seconds, I know that you are maybe in your office, maybe in your home, so feel free to do whatever you need to do. And now is a truly honored to introduce the next speaker. Somebody that I know for a long time, a good friend, a good colleague, learning a lot for her. And this is Dr. Marta Altihai. She's a clinical psychologist and she's an independent consultant. And Martita, thank you so much to be with us in this summit. The floor is yours.
Well, good morning, everyone. And thank you so much, Luis, for your invitation, and for everyone who made this possible. I'm a little bit nervous because technology is not my friend, but Blanca has lent a lot of assistance, and I think I'll be able to do this. So
don't worry about it. I am the same. In technology, I am so stupid. So
right.
Okay,
right?
yeah. So
but
okay.
but I want to thank all of the organizers and the supporters of the summit, particularly for giving voice to the issues that the rest of the world is not speaking about, right? The Latino
Correct.
community, or as now we've gone to Latinx community. But one of the things that I feel a great deal of responsibility about is that here I have this forum, and as Luis always tends to do, he asks for big coverage. So he wants me to talk about Latinx, LGBTQ plus, and COVID. And what I want to do is I want to have a conversation with all of you, because obviously no one is the expert on all of this. And in the conversation, I am going to make some suggestions, and I'm going to present a little bit of data, but really it's about all of us thinking, how do I take all this information that I'm getting and make a commitment to learning more, to developing more skills, and to being not only a mental health care provider for those of you who are that, but also an advocate, also somebody who promotes different policy perspectives, also somebody who, when you notice that somebody's voice is not being included, raises their hand and says, excuse me, we're leaving somebody out. So I'm hoping that that's what I'll be able to do today. And I am going to share with you all my PowerPoint presentation. And let's hope this works. Ready? All right, let's go.
Yes, we're ready, Martita.
All right. So in our conversation, I think we need to have, you know, what the sign of an intelligent mind is that you can hold many facts at the same time. And we're going to have to hold a lot of facts when we're looking at the Latinx LGBTQ plus community. There are so many things that impact our communities, right? It's not one monolithic community, it's many communities. And we are being attacked really by the state-sanctioned violence that is happening for people of color, particularly with regard to my theme for transgender women of color. And then the pandemic and all of the difficulties that that's brought on. So some of the stressors we face that I could think of, and I'm sure you could think of more, so please add in the comments. Being part of multiple minority status or stigmatized or oppressed or whatever you want to call it communities. Clearly, I am not saying that we are less than. I am saying that we are in a condition in this society of facing a lot of struggle. Our communities are faced, you know, with homophobia, transphobia, coming out process, the stresses associated with the coming out process, which are many, right? And are we out to our care providers? Are we out to our family? Are we out at work? All of those things. And all of that stresses us out when we can't be ourselves everywhere we live. We are definitely, as the past presenter spoke about, overrepresented in COVID-19 infection and death rates. And not only are Latinx overrepresented, but a Latinx who is also an LGBTQ plus person is triply overrepresented. We face sexism, victimization and violence, racial and ethnic bias, a culturative stress for those of us, you know, even if we are born here, even if we've been many generations here, even if our family was here before the border crossed us, right? We still have to acculturate because we are faced with having to come out into a world where our maybe cultural beliefs and practices are not the main. For those of us who are immigrants like myself, we face immigration stressors, and I'm fortunate that I came here very young. But for folks who come at older ages, there's a real loss of their daily living, right? Everything shifts when you come to the United States. Your support network shifts or disappears completely. The foods you eat, the languages you speak, the schedules you keep all change. By and large, Latinx LGBTQ plus people live in under-resourced communities. Our communities don't get as much tax money. We don't have as many clinics, hospitals, libraries. We hear about food deserts, right? Where we don't even have markets that are appropriate to our well-being. And of course, HIV infection and AIDS. Ooh, see, this is, okay. Maybe a little stuck, okay. So I want us all to take all of everything in and have a more holistic perspective of our communities, understanding how we define ourselves. And sometimes people get confused, right? Particularly when they think about all the letters of the alphabet that the LGBTQ plus community is. But if you happen to be Latinx, think about the process that we've been through in defining ourselves and the different names we call ourselves, and how that has been a politically empowering thing, how that has been a way for us to take some of our control back, how that has been a way to be more inclusive rather than exclusive of folks that do belong in our communities. And so understanding how we define ourselves is important. Respecting our intergroup diversity so that we are, like I said before, not a monolithic community, but we are many communities under one umbrella. Acknowledging the reality of oppression, right? That we do face that on a daily basis, sometimes little oppressions, sometimes huge oppressions, but that's a daily thing. And sometimes we get used to it and we just deal, but it still has an impact on our mental health, our physical health, our humanity. And then I want to shift a little bit and talk some more about how we become empowered through connecting all of these things that impact us. Intersectionality, not only as a way of seeing all of the oppressive forces that impact us, but of figuring out how to build bridges with others and connect and advocate for all. I also want to, I do have data, so because that's my background. So I do have some data related to COVID and how it's impacted the Latinx LGBTQ plus community, and I want to share some of that with you. And obviously it's impacted us on many levels, but I've just chosen a few to show you. And then I want to talk a little bit about consideration for treatment and self-care. This is not to say that I am going to teach you anything about doing therapy. I think all of you probably are very well versed and have a lot of training, but I want you to have a specific mindset, or to challenge yourself to have a more flexible mindset when you're dealing with our communities. And I want you to pay attention to taking care of yourself, because burnout is coming, because we are, dealing with a lot. All right, let's see. All right, so what's in a name? If we think just in terms of the LGBTQ plus community, in terms of gender, for example, I think a lot of people have a binary perspective on gender. I was really pleased to see that in many of you have, besides your names, you have your pronouns, which is really great, because there is a spectrum of gender. There's female, there's male, and then there's everything in between. Then there's how we express our gender, right? So I'm cisgender, and I express very feminine, and I'm a lesbian, but folks, sometimes confuse me as an old Latina grandma. And I am a grandma, but I'm cute, aren't I? Right, right. Somebody smile. We also have the sex that we are assigned at birth. And currently, most birth certificates are binary. They only have male or female. Some have intersex. But the reality is that even biologically, there is a spectrum to the sex that we are born with. So we have to think about that and how people understand that about themselves and what they feel about that. Physically attracted to, are we attracted to those of the same gender, different gender, somewhere in between, multiple attractions, and then emotional attraction. So our alphabet is L for lesbian, gay, bisexual, transgender, queer, questioning, queer people of color, queer or trans people of color. And we have evolved, right? I'm old enough to remember when it was the gay community. And I'm old enough to remember when it was the gay and lesbian community. And what a celebration it was for those of us who identify as lesbian when lesbian came first. And then our younger sisters came and said, blow that, you know, I'm a queer person. And so we are challenged to evolve. We also have intersex. We have folks who identify as asexual. We have allies, right, that believe in our cause. We have folks who identify as pansexual, demisexual, non-binary, genderqueer, gender nonconforming. And if any of these terms are terms that are new to you or terms that you haven't heard, because, you know, we like I said, we are evolving. I challenge you to either ask in the, you know, in the question segment of this presentation, or to Google these terms. There's a lot of information out there. We don't have to stay confused. We can make it, take responsibility for educating ourselves. Que hay en un nombre, right? The Latinx community has been through many names that we have been assigned or that we have claimed. And even now, this chart shows, you know, some folks identify as American first because their families have been here for so many generations before this was part of the United States. Others identify as Hispanic, Latina, Latinx, Chicano, and you can see kind of, this is a good historical picture of how we have politicized the name we call ourselves. But it started out being Spanish, Latin, Hispanic, because maybe we didn't want to associate with Latin America because, you know, there are folks that are from Europe, Latino, Mexican American, Chicano, Latina, when we were trying to be more inclusive, Chicanx, Latinx, and then some of us still identify by the country we come from, Guatemala, Mexico, etc. And I want to talk, because of the issue of intergroup diversity, I want to talk about some of the primary dimensions of diversity, right? So H, just in talking about the different names we use for ourselves, you can think about that it is a generational thing a lot of the time. So older folks may use Hispanic more. I know that a lot of my colleagues have a real issue with the term Latinx. They hate that X at the end. They think it's just nasty. I, as a Latina lesbian, I find it more inclusive, so I'm grateful for it. There's also ethnicity, right? We are not all from one land base. We come from Central America, South America, and even within a country, if you look at Mexico, Mexico is huge, right? And if you look at someone who is from the north of Mexico and somebody who's from the south of Mexico, their ethnicities are going to be really different, just shaped by the culture they live. Then, of course, there's the dimension of our physical abilities and mental abilities. There's race. I think that very seldom when we talk about the Latinx community, we include Latinx people of African descent or Latinx people of Asian Pacific Islander descent. And they are part of our countries, they're part of our communities, they're part of our culture. So we need to keep that in mind. And then, of course, gender and sexual identities. And I just put up some really pretty pictures because some people are more visual in their understanding of ideas. Secondary dimensions of diversity are our educational background. And you already started to hear how SES impacts our access to services, right? Not only mental health services, but COVID-related services. When you look at the death rates that are associated with COVID, the majority of people are folks with with a high school education or less. So our immigration and legal status, this is something that really impacts families, right? If you have a family with mixed legal status where maybe the children were born here and the parents don't have legal permit to work, the stress associated with always worrying about whether somebody is going to be deported, whether we can apply for relief, all of that stress can do really a lot of harm to a family. Our income level, of course, as in all communities, impacts how we can access resources. Employment status, which has been impacted very significantly with COVID, our religious or spiritual beliefs, And now, a big thing that is becoming an issue that separates us sometimes is our COVID status, whether you're COVID positive, whether you have had COVID, whether you've always been COVID negative, whether you've had the vaccination, whether you've had all of the vaccinations, whether you're done or not. People are talking about vaccination passports and what that would do to certain communities who can't access those things. So those are things that are important to keep in mind as you work with children and families, because different folks in the family will be impacted by different issues. And I know that we all are familiar with what oppression is, but I just want to remind us, right, that it is the state of being subjected to unjust treatment and unjust control. It is a control mechanism, right? And prejudicial and discriminatory attitudes are put upon us by folks who are part of the political system. So whether folks have social, political, or economic power, they use that power to impress their attitudes upon us. But what I don't want us to think about is I don't want us to think that that is an other oppressing me. I want us to think about how we are also part of oppressing others. And where are the places where we have power, and how responsible are we in using that power, right? Because most of you, for example, this morning, who could get up, easily open your computer, have Wi-Fi, and get on this Zoom call, that's access to information that a lot of folks don't have. And what are we doing to make sure that everybody in all communities has access to wideband, right? What are we doing to make sure that in the places where I control stuff, I'm thinking about others who don't have that access? So oppression is used to maintain the status quo of systemic oppression. And like I said before, none of us are impacted by just one issue in our life. We don't live single issue lives. We live lives that are impacted by many aspects. And this quote by Audre Lorde is one of my favorites. So I wanted to share that with you. So we don't live single issue lives. We're impacted by immigration status, all of the things that we've been talking about. And intersectionality is the interconnected nature of social categorizations, right? All of those little bubbles that I had in the previous slide, and how those overlap to really stress us out. Because I could be very comfortably living my life if I just sit at home and I don't have to worry about having to go out into the world and decide today whether I come out or not. Or whether, I have a car that will start and get me to work so that I can make money to pay for my kids' doctor's appointment, or to put food on my family's table. But no, we are human beings, and we live, and we have many things impact upon us, and the stress then begins to pile on. So a more holistic approach to working with folks is to pay attention to all of those stressors and help folks connect the dots, right? So if somebody comes to you and starts to talk about racism, starts to talk about the inequities that they face every day, the oppression that they face every day, it's important to engage them in that conversation, because by allowing conversations to happen, we open doors for people to empower themselves. And I have a kind of funny story about that. Many years ago, my wife and I were talking about just client stuff. And I said how interesting it was that so many of my clients were really talking a lot about racism, about sexism, about homophobia, and about the struggle. And she said, well, that's really interesting. A lot of my clients are talking about spirituality and religion. And then we both just had to look at each other and start laughing, because those are the issues that are important to us. So as clinicians, of course, we were pulling for that in our clients, which is not a bad thing, right? We're human beings, and we use ourselves as tools. So we pull for the conversations that we are comfortable having. But how do we expand our toolkit to have conversations about things that we're not familiar with? How do we educate ourselves? How do we help our clients educate us without burdening them for our education? So if a client comes to you with an issue that you're unfamiliar about, maybe it's a transgender client who is considering maybe transitioning and wants to know more about medical services. Well, maybe you know nothing about that and you feel like, well, I'm gonna have to refer because I don't know. That's an option. Another option is for you to get some resources together, educate yourself, get some consultation with somebody who has expertise in that area and work with that client, right? This is how we begin to have a more holistic approach and build those bridges so that we can empower ourselves and our clients. Now, some of the impact that COVID-19 has had on the Latinx community, 18.5% of the US population is Latinx. But according to the CDC, as of May 12th, Latinx community comprised 29% of COVID-19 cases in the United States. And more than 18.6 of the COVID-19 related deaths were among the Latinx community. And that's a very, that's sort of the base number where it starts. If you start sort of looking into the details, some sources are quoting up to in the high 20s, low 30s% of COVID-19 related deaths within the Latinx community. Now, if we look at employment, we know that job loss is associated with increased depression, anxiety, distress, and low self-esteem, may lead to higher rates of substance use disorder and suicide, particularly when the orders to stay at home were in effect. We saw substance abuse begin to rise very quickly. During the pandemic, adults in households with job loss or lower income have reported higher rates of symptoms of mental illness. Look at the difference in numbers, 53 versus 32. That's a huge divide. Specifically related to the Latinx community, we know that our communities work essential and service jobs, and that because of COVID, these industries have crashed. So, you know, the hotel industry has crashed, the travel industry has crashed, restaurants are closing, right? Or, well, opening back up now, but closed. So people lost jobs or got their hours cut, or folks work in frontline places like hospitals, like grocery stores, where they were at higher risk for being infected. So compared to non-essential workers, essential workers have symptoms of anxiety or depression that are higher, 42% more reported, 42% reported those symptoms versus 30% of non-essential workers. Starting or increasing their use of substances, 25% of the Latinx community reported that versus those who are not essential workers in the Latinx community. And suicidal thoughts, 22 versus 8%. Those are significant numbers, significant differences. Specific now to the LGBTQ plus community, the Human Rights Campaign put out a report that said that Latinx LGBTQ plus people are more likely to report income loss than either Latinx or LGBTQ or the general population. So 40% of Latinx LGBTQ plus respondents have had their work hours either reduced due to COVID, compared to only 32, and when I say only 32%, I know that those numbers are not insignificant, but I just want you to see the difference. And this is where I say that, you know, the stressors begin to add up, because the impact on us when we are part of multiple groups that are stigmatized is higher. Unemployment within the LGBTQ plus Latinx community, 20%, compared to 16% of Latinx respondents, 15% of LGBTQ respondents, and 11% of the general population. And so what happens, right, when we lose our jobs? Not only are we having all the effects that I talked about before, the depression, the anxiety, the increased substance use, but other stresses starts to happen. We can't afford our rent. We can't afford gas. We can't, you know, we are unable to access services because we can't even get to places. With regard to taking unpaid leave, since the onset of the pandemic, 20% of Latinx LGBTQ plus respondents said they had to take unpaid leave. So income gone, right? The transgender communities have had increased rates of gender-based harassment, violence, and murder. And their rates were already increased, And so the pandemic has made that worse. And some of the reasons for these are, of course, think about a transgender child who probably at home was having a very hard time, but could go to school and maybe there found a supportive environment, or maybe not, but some kids did. So now they're stuck at home. They can't reach out to friends. They can't go to school and, you know, hang out with that, maybe that teacher that really protects them. They are facing more harassment and even violence. Lack of access to gender affirming medical services. We all know that hospitals were, you know, overrun with COVID-19 related services. So providing those services. So a lot of things that were considered elective treatment were stopped. And of course, a transgender person who has made the decision to transition medically, for them, this is not an elective service. This is a life-saving, affirming service, right? So to have to put it on hold further is difficult. The transgender community already has higher rates of HIV, asthma, diabetes, and heart disease. And you know that in the Latinx community, the rates for diabetes, for example, is also higher, for HIV is higher. So, you know, that compounds not being housed in gender appropriate institutions when they are in institutions. So for example, you know, migrants coming from other countries to seek asylum because they faced violence in their own country for being transgender. If they are put in holding institutions, seldom are they put in the institution that suits the gender that they identify with, right? So transgender women are placed with men and experience then more aggression, more violence, you know, more trauma. Hostile work or school environments, and lack of access to public spaces, right? We have been through that whole slew of bills against, you know, transgender people being able to use the restroom, transgender athletes being able to play in teams, et cetera, et cetera. There's also discrimination in accessing emergency and disaster relief services. So there was a study, and I don't have it here, but if anybody wants the citation, I can find it, that looked at particularly disaster relief services and how folks were either what ease they had in accessing them. And there was a report about transgender folks because of the way they looked. Not even, let's not even talk about the documentation that they had that didn't match their gender identity or whatever, but just because of the way they looked, had a harder time accessing disaster relief services. Lack of access to social support networks due to school closures, like I said before, and decreased opportunity for congregating in spaces. Lack of access to psychological evaluations for asylum cases. Now that's already a problem for all of the folks coming in from other countries seeking asylum, but it's a higher problem for transgender folks because there are not a whole lot of clinicians volunteering to work specifically with them or who know the issues that they need to ask about and how they need to write reports that reflect the trauma that they're facing in their countries. And then, of course, human trafficking. With regard to suicide, the Trevor Project did a really nice study on Latinx LGBTQ plus youth. And what they found was that they were 30% more likely to report a suicide attempt in the past year compared to non-Latinx LGBTQ youth. So that's a 30% may not seem like a lot, but that's, you know, 1 in 3 kids more. 17% of Latinx LGBTQ plus youth reported attempting suicide compared to 14% of non-Latinx LGBTQ plus youth. And Latinx LGBTQ plus youth who are 18 and older had more than twice the odds of not just suicidal ideation, but of actually attempting. LGBTQ plus Latinx who were assigned female at birth and were identified as transgender were nearly at 40% increased risk of suicide. And Latinx LGBTQ youth who completed the survey in Spanish, right? So probably monolingual Spanish speaking folks, were at 84% increased risk of suicide. That's a huge number. And the higher risk of attempting, this is a really interesting one, particularly when we're talking about families that have mixed legal status, because the higher risk of attempting suicide in this study among Latinx LGBTQ plus youth compared to non-Latinx LGBTQ plus youth could be explained by their increase in worrying about whether they or a family member would be deported due to immigration policies. So think about the dreamers, right, who have known no other home than the United States because all of their formative life has been spent here because they generally were brought, very young. Going to school, going to college, going to university and thinking, is today the day that I get deported? Or think about little kids who were maybe born here and are already struggling with a bunch of stuff, and they have to worry about, is my parent going to come back home today from work? Or are they going to be taken from me when they're dropping me off at school, as we've seen happen? So Latinx LGBTQ plus youth who worry about being deported or having a family member being deported, they're at double the risk for attempting suicide. So not just thinking about suicide, but attempting suicide. And these are the graphs that show those differences among those groups. I want to show you the other side of this, which is, right, that's the societal impact. But I want you to think about also the impact that families have on LGBTQ plus youth and family members. Because I think that is an easier approach and you have easier access to those folks, right? When you're working with an LGBT child or individual, you can access their family and do some quick education that makes a huge difference. And this information is from the Family Acceptance Project out of San Francisco State University. You can access their updated projects and videos online. So the lifetime suicide attempts for kids who are LGBT and experience low rejection in their families is the same as other kids their age. When they experience moderate rejection, it goes up to twice as much. And when they experience high rejection, look at how high, 8.5 times as much lifetime suicide attempts. Teaching families to be more accepting in their behaviors, and obviously it will take time to change attitudes, but in their behaviors at least, and in ways of advocating for their own family members, their own kids, is an easier haul than changing policies in society, right? With illegal drug use, the same thing. Low rejection, kids are just as likely to use illegal drugs as other kids. 1.5 times higher when rejection goes up to the moderate level, and 3.5 times higher when it goes up to the high level of rejection. Risk for HIV infection, same. Low rejection, the same as everybody else. Moderate, 1.5 times. High, 3.5 times. So experiencing rejection from our families, particularly within the Latinx community, right? That is one of the values that is held high. Generally, no matter how much we acculturate, we still hold our families in really high esteem. It is generally the place that we can go to for, protection, for belonging, for being known. So rejection from our family is an impactful thing. But then look at this. Look at acceptance. And what they did was they questioned kids and whether they believed that they would grow up to be happy LGBT adults. Kids who had extremely accepting families, kids that can talk about themselves and their partners and their friends and their everything with the family, 92% of them believed that they would grow up to be happy adults. Kids who had very accepting families, 77%. By the time we get to getting just a little bit of acceptance, the number goes down to 59% and 35% when there's no accepting in the family. Those are facts that you can take and do some really good psychoeducation with the families. Because if you ask a parent, well, how much impact do you want to have on your child using drugs? My sense and my experience is that, 99.9% of the parents are going to say, I really don't want my kids to get into drugs. Even if I'm a drug addict, I don't want my kids to get into it. Well, then you say, I have some things that you could do that can help reduce that risk. Boom, you got their attention, right? All right, so in our work, particularly during COVID, we've had to adjust. We've had to become very flexible. We've had to make use of telemental health services like Zoom and other platforms, voice, text, or email. But the thing with that is that, one, we as professionals have had to adapt our skills and our comfort level with that. And as you saw in the beginning, me, kind of struggling a little bit with technology, we've had to learn a lot very quickly. That's one aspect of it, one side of it. Another side of it is, do our clients have access to Wi-Fi, to electronic devices? Do they have spaces in their house where they can have privacy, right? Latinx community, we tend to live in places where we may have multi-generational families living together, where it's hard to find a quiet space where you can just be to yourself. And so part of the work that we have to do when we shift to telemental health is that we have to work out with our clients a plan and help them think about all the things they need to put in place in order to have that privacy that they would used to have when they came into our offices, right? Because one of the things that's happening with younger people is, as they get so used to living their lives on social media and talking on their cell phones everywhere and anywhere, they have forgotten to put those filters down for real private conversations. And so we have to remind them that some of the issues that we discuss are issues that they have a right to keep really private for their own safety sometimes. It's important when you work with the LGBTQ plus Latinx community that you confront your own transphobia, your own homophobia, your own heteronormalism on an ongoing basis. Because you may say, well, I have no issue with gays and lesbians, that, they got to live their own lives and I'm okay with that. What about transgender people? Do you know anything about transgender people? Do you know about the importance to them of not being called by their dead name, right? The importance for some of them, not all of them, but for some of them to medically transition. And for some of them really don't care about medically transitioning. And you have to be able to know that it isn't the same path for everybody. And a really good test that I think you should always do if you think that you're open-minded about the LGBTQ plus community is, if you're a parent, think to yourself, what if my child was part of that community? How would I feel about that? What would I think about it? It may be that initially you'd say, well, I love them anyway, but I'd be really afraid for them because the world would be so dangerous for them. And this is true, but you could always say, I love them and accept them. And just like with all the other dangers all my other kids face, I would help them navigate those dangers. I would learn about helping them navigate those dangers, right? Now, it's a process, but this is a good way for you to gauge where you are in terms of your ability to be not only supportive of clients that are LGBTQ plus, but help them grow and help them, celebrate them just like you do your other clients. With regard to working with the Latinx community, language skills are really important, right? And so you may say, well, I speak Spanish really well and I can hold a conversation well. As we know, clinical conversations are really different from day-to-day conversations. So we have to make sure that we have that expertise. And we also know that not everyone who is from Latin America or identifies as Latinx or is even an immigrant speaks Spanish. There's more than, more than 30 indigenous languages. Well, and I know that in Guatemala, there's more than 26 indigenous languages. In Mexico, there's a host of indigenous languages. So somebody may come and pretend that they are understanding you by smiling and nodding their head, but that's just because you are, somebody they respect. It's important to do that back translation thing that we were taught in training, to ask clients, what did you just understand me to say by what I said? Not only for seeing if they got the concept, but for seeing if we're using the appropriate language with them. And then being open-minded enough to say, well, I know my Spanish is really good, but maybe it's not the correct Spanish to use from somebody from this country because I learned it in this other country. Maybe I need to be more careful. With the LGBTQ plus consumers, it's really important that your agency have a commitment to having a respectful environment that is welcoming. And that can be done just simply by, having like PFLAG material out in the waiting room, having a pride flag sticker, in the offices, making sure that you're welcoming folks, whether it's a receptionist or whoever it is, the first contact that people come into contact with, have enough training to know what to do if there's a transgender person in the waiting room and another client comes in and starts staring or starts being rude or whatever. How do you intervene respectfully to make sure that in your place of work, folks are all treated respectfully? At intake, always ask about sexual orientation and gender identity and allow individuals to define themselves. Use the pronoun and name that the individual uses for themselves, regardless of what your chart says, right? Our charts have information that people just copy off or that people feel they have to put on there because it's legal information, but it's not necessarily the right information to use. And always work under the assumption that LGBTQ kids and family members will be accepted by their family. And if they're not currently being accepted, it's your job to help them get to that place. So unless you have information that there's abuse in the family or that there's really high rejection, welcome the family to be part of treatment. And of course, ask about immigration concerns. Provide access to updated COVID-19 information. This is always changing, right? So we have to help folks be able to log on to sites that are reputable, that will give them good information. Ask individuals who are questioning their sexual orientation or gender identity, how their family supports or doesn't support them. Who are they out to that they would like to continue to come out to? Who do they consider as their support system? Identify current, and current should be underlined because resources change all the time. So if you're going to give somebody a resource that's either in the community or online, check it before you give it out. There's nothing more frustrating for a person who feels that they're finally going to get some help somewhere or some answers somewhere or some information somewhere, and then they go to a site and it doesn't apply to them at all, or they go to a place and those services aren't there anymore. Provide supportive counseling, assess for risk behaviors, and this is really important. If you don't feel that you have enough experience or enough training in working with the LGBTQ plus Latinx community, get consultation, go to more trainings, make sure that on an ongoing basis you're upgrading your skills, and help educate family members by giving them context to the videos in the Family Acceptance Project. So I know that all of you have been trained in trauma-informed services and probably do a really awesome job about that. But I want you all to also think about resiliency for yourself and for your clients. And coming out of the pandemic, we can all either just be stuck with real symptoms of post-traumatic stress and a lot of discomfort, or we can slowly move into post-traumatic growth. And we do that by using resilience as a framework for understanding the shared trauma that we're all going through, right? So resilience is a skill that allows us to bounce back from setbacks, handle rejection, persevere, and succeed in spite of adversity. It's an effective approach linked to lower levels of stress and better ways of managing situations. Now, how do we develop resiliency? Get perspective, I know that with my daughter, I would tell her, this is not the end of the world when she would stress out about something. And she would say, I hate it when you say that. And so I asked her, well, what other thing would help you? And she said, oh, tell me it's not the end of the story. I thought, well, that's simple enough for me to do. Just say it's not the end of the story, but ways to reinterpret the situation so that you know that it's not going to last forever. Many times when I'm working with suicidal clients, I quote that thing that everybody uses of, this is a permanent solution to a temporary problem. Help people see how their emotions change from moment to moment, from situation to situation, and even within the time that they're with you. Help them see how they might come in really stressed out, but by just sitting and breathing with you, it can all change, right? So that's getting perspective. Being present, help people get to notice their heartbeat, notice their breathing, notice how stressed their body is, notice how that changes when you talk about different topics, notice how that changes when they sit in a different position, even how much our physical and mental self and our spiritual self are all connected and have impact on how well we can put up with the stressors of life. Help folks learn to ask for help in effective ways, right? So don't, many times people just say, I'm all stressed out, I need you to take care of it. And that's not really what they need. What they might need is just to be heard out without being interrupted. What they might need is just some information that is very specific. So help folks be very specific in how they ask for help, and to maintain a network of people who they trust and they know who to go to for help so that they don't burn out their network, right? Understand what triggers you and help your clients understand what triggers them. And know that failure happens and that we get over it, right? Get a lot of sleep and healthy nutrition. And also be aware to not over rely on resiliency, right? That if you think that you can take on everything, what you're doing is you're overstressing yourself, and at some point you're going to explode. So it's okay to sometimes put really good boundaries around yourself and say, okay, this has to stop. I'm done, right? I want to get to just a couple of questions that I want you to all reflect on, and I don't want to run out of time, so I'm just going to skip right to that. But I want you to think about what you could commit yourself to. One new daily habit that supports your well-being and promotes your resilience. Because if you can experience a little thing that you do every day that helps you, you're more likely to be able to help your clients identify those things. So, if it's maybe just going out and sitting in a park for, 20 minutes a day, or if it's taking a walk around the block during your break, whatever it is, one habit that you will implement starting today that you will do every day for at least 3 weeks, and see how it shifts your well-being. Commit to acknowledging and being aware of the intersecting oppressive forces that impact your life, and building bridges of support with others that can help you not feel crazy. Because sometimes when we are the only voice saying this is wrong, or you forgot this, or you didn't include this, people will make us feel like we're crazy, or like we're a one-note piano, right? That we're always talking about the same thing. And maybe we're always talking about the same thing because we're the only people talking about it. So build a network of folks that will support you and that will sometimes take that load so you don't have to fight the fight every day. In regards to how we sit with clients, how we approach them, I want you to think of a time when you received help, when you were in a really stressful situation and you received help and your humanity was respected, where you felt that you were seen and that you were heard and that no judgment was placed upon you. Think about what the factors were that led you to feel, wow, this person gets me. And then begin implementing some of those things in your work and making sure that they are part of your work with clients. Likewise, think of a time when you felt humiliated when you sought help. And make sure that none of those things are present in your agencies, in your offices, in the work that you do with clients. And think about some of the issues related to diversity which are important to you. So, maybe an important issue for you with regards to diversity is sexism. Well, create effective connections for folks that will work on sexism within the Latino community, or create effective relationships for folks that will work on issues related to ageism within the Latinx community, right? make sure that you don't feel that you have to work on everything all on your own. And then also think about some issues related to diversity that are very difficult for you. So if anything I mentioned today about the LGBTQ plus community was difficult for you, create some folks that are your trusted allies who will help you gently, but honestly see where you're off and will point you to resources and support and information and consulting so that you can be a better ally for the community. In regards to resilience, I want you to think about how do you encourage and support resilience in your clients, in the workplace, with your colleagues, in our communities, and what are the situations in which being too resilient can make things difficult. Now, for those of us who work in mental health and work in community-based organizations, we are constantly getting the message that if we're not working 24/7, we're not doing enough. I want you to say, forget that. I was going to use another F word, but I've remembered where I am. So just say, forget that. If I don't take care of myself, I am not a good role model for the community. If people see that my work burns me out, they're going to think there's something wrong with my work. So think about those situations where being over resilient and just taking on everything people ask you to do is too much. And make sure that you have clear boundaries to protect yourself. Now, I always like to end with challenging everybody to take action, because I think that it's great to come to all of these summits and conferences and meetings and hear a lot of wonderful stuff and feel all empowered and, the presenters are so great. But what are you going to do about it? What are you going to do with this information, right? So I want you to identify an action item, and maybe each and every one of you can put into the comments section of the Zoom what action item you identify. Maybe today you're going to Google a term that you didn't understand. That's an action item that will increase your knowledge. Maybe today you are going to talk to a colleague that has more experience in a certain area than you do and ask them to help you by giving you some references to books or videos or stuff that you could look at that would help you get better at something. That's an action item. Maybe today, in addition to developing that healthy habit that you're going to start developing, you're also going to maybe call one of your representatives and tell them how important it is that mental health funding be increased. I don't know, choose something and commit to doing it today. And also choose something that is not just for you, but for the community's well-being. And so I want to just leave you with my hope that some of what I said triggered some thoughts and some ideas of working together. I want you to have my contact information because I'm welcoming of anyone who has questions. Maybe sometimes we go to conferences and we're so overwhelmed with information that we can't think of questions right away, but later on we do have them. And so I want you to have my contact information. Thank you all so much.
Thank you, Marta. Thank you so much for all the information that you provide to us. I think we know many people working so hard in the last 20, 30 years with the LGBT community. They are underserved, unserved, but also I think the system, we need to learn more and have more knowledge about how we can engage this population, how we can provide more services. And you say something so critically important, how we can work with their families. When you see this graphic regarding family rejection, when it's high, when it's low, when it's moderate, it's a big difference. It's a big difference. And they face multicultural issues, not only for the family, for the social component. So it's so important. And again, when we talk about disparities or inequalities with populations, this is another big group of minorities. This is another big group. So I really appreciate your work for probably more than 20 years that you are doing in this regard. And we're planning to open for questions for Dr. Alki-Hyde. So please raise your hand and I will access, you can unmute yourself and we can have direct conversation with Dr. Alki-Hyde, please. Anybody? I don't see any hands go up, but I have again a question for the chat. And the question is, we know that in the last 2-3 years, racial issues, discrimination, plus the gender identity is a big issue regarding consider suicide or attempt suicide. How we can deal with all these issues?
So it's overwhelming, right? And it probably overwhelms you to think I have to take care of all of this at once in order to help a client get better. But sometimes the simple act of acknowledging that, yes, you're right, this is stressful. We do live in a racist, homophobic, sexist community, society, and these things that you are feeling are right. But do you want to take your anger out on yourself, or do you want to take that energy and do something about it? And how can I help you connect with folks who can help you do something about it? How can I help you not deal with this alone? Because being alone is one of the things that most leads us to thinking that we'd be better off dead, right?
Yes.
And so if we're working with a person whose family is available and they are dealing with all these issues, then it's important to say, who in your family is your support system, or who in your family is the ambassador that will take to the rest of the family the knowledge of how you are feeling and can bring back some support, right? Because in the Latino community and Latino families, we always have one person who is el periódico sin fecha, right? The ambassador that takes the information about who's dealing with what, and we need to rally up and take care of that person. So that's, the clinical aspect of it with your clients, with the families. Then we have platforms, right? We are considered professionals. When we speak up, more people listen than when just a regular community member speaks up. So why not use those platforms to do trainings in your own agency, to call on your elected officials about resources, about things that you see happening, to be part of policy creating that changes, for example, how the police respond to a mental health case that includes a person of color that maybe is transgender as well. Like, take it to that level of detail, to do your trainings on that, to speak up about that, to educate the folks that are in your sphere of influence. And that's where it begins. Obviously, much work needs to be done. None of this solves everything, but we plant seeds. And today there's this whole lunar eclipse, right? Which is a sign for chaos, but also for planting change. So let's begin to plant some change now.
Correct. We have another question in the chat is regarding this person said, how I can speak, in my agency in the top level about these services, be more open mind, be more sensitive, have more compassion, but also address the issues about these inequalities with the LGBT community, how we can speak with them.
As somebody who's been doing this for over 20 years, like Luis mentioned, one of the things that I do whenever I write reports, and Luis can attest to this, even if the agency hasn't asked me to look at LGBTQ plus issues, I always say, well, this agency is doing an awesome job on this and this and this and that. However, I see that they don't even have programs for LGBTQ people.
Correct.
And in your own agencies, what you can do, because, folks do not want to hear our feelings. Folks do not want to hear our anger. That scares them. So what you can do is bring statistics. You can use some of the statistics from the Trevor Project, from the Human Rights Campaign, some of the statistics presented earlier, and say, look at the community that we're in. Look at the folks that are coming into our clinic, and look at who's not being served. And here's an idea of what other agencies have done to welcome those folks into their services. Here's the way that they've made their services accessible. And be prepared, right? Because every time that we speak up, what happens? We get told, well, you do something about it. So be prepared to say, well, I can't do it all because I'm working on not over relying on resiliency, because Dr. Alkihai said that would burn me out. But I can maybe head a group of folks within the agency who can help. But we're not going to do it as a side thing. In order to show that you have commitment to this, it has to be done during our work hours. and maybe there can be somebody from administration that can participate in that group. Now that's asking for a lot, right? And you'll probably get a lot of pushback and a lot of no's, but at least you're putting people on notice that you know what it takes to create change. It's not just screaming about it. It's not just being sad or angry about it. It's about bringing a plan. It's about giving them data. It's about saying, here's what others have done and here's what resources are available. That's one idea that I have.
No, I think make a big difference, Martha, when I call the facts and the evidence. Facts and evidence regarding the data, regarding the statistics. You can imagine the LGBTQ youth, they have double in the regular, children between 3 to 18 years old is like a 12% people consider suicide.
Mm-hmm.
When we talk about LGBTQ, it's 22%, 23%, almost double. If you add, family rejection and other social determinants involved, even will be even, there we go, even higher. But Martha, thank you so much for your amazing job that always you do. Really appreciate that you making the time from your busy schedule and share with all of us, all your expertise regarding this population, regarding the psychological impact of COVID-19 in our community, but the most important, with your amazing work that you do for all the community. Thank you so much. God bless you, and I see you and I talk to you later on.
Very much.
Thank you.
Bye.
Thank you. Bye-bye. Okay, folks, the last speaker is ready. This is somebody that I know for more than 20, probably 5 years, a good friend, a good colleague. He was an LBHI with Ambrose Rodriguez, which rest in past, please. And we do, I think, few projects together, always participate and make emphasis on how we can address issues with the Latino community. He's a professor at UCLA. He's the medical director for Olive View Medical Center, even medical director for San Fernando. Dr. Alex Kapelowicz. Thank you, Alex, for being here with us. The floor is yours. Alex, maybe you're unmuted.
So, Luis,
Yes.
I'm trying to use my phone as the audio because my computer's not working great. Can you hear me okay?
Yeah, we hear you okay.
No echo, no anything like that?
A little bit, but don't worry about it.
Okay, I'm just gonna try something real quick. So let me just, tell me if this.
Thomas, no.
You're on mute.
It sounds fine.
The phone,
sounds fine?
Yeah, the phone is fine. Yeah, there we go.
Okay. All right, well, we'll try it this way, I guess. Hang on one second. I'm just playing around with things. Okay, how about now?
You're okay, better, a lot better. Thank you, Alex.
Okay.
Thank you so much.
All right. Okay, thank you very much, and thank you for the invitation, Luis. It's a pleasure to address your audience today, and I really enjoyed the talk that Martha did. It was really very inspirational, and hopefully I'll be able to give you a little bit of the data and statistics that you were asking for in this presentation. I'm sorry I wasn't able to see Dr. Aguilar Gaxiola's presentation, so I apologize in advance if I present data that is similar or redundant to what he was doing, but I want to use some data to justify the project that we're in the middle of doing right now. Blanca, if you don't mind, can you share the screen with the PowerPoint that I sent you?
Okay, yeah, we will do it, Alex. There you go.
Yeah, Blanca is much more technically savvy than I am, so I appreciate her helping out.
Totally agree with you, Alex.
Okay, very good. So the title of my presentation and a project that we are currently working on, and I want to acknowledge, although I'm doing the presentation, this project was really a joint effort with a lot of people, and my most important colleague in this is Dr. Steve Lopez, who is a professor of psychology at the University of Southern California, who has been my colleague for many, many years. So I will refer to him often in this presentation, but I just want to acknowledge his work and his vision in the project I'm about to tell you about. I also, because I work at both Olive View as well as at the Geffen School of Medicine, have to acknowledge them in this slide. And even more importantly, I have to acknowledge my daughter who helped me put these slides together. So if they look very savvy and hip and media, that's because my daughter put them together for me. So anyway, so the title of this presentation is Enhancing COVID-19 Knowledge and Safe Practices Among Individuals with Severe Mental Illness in the Latinx Community. So many of you are aware of the fact, as you've heard in presentations today. Now, go back one, Blanca, I'm not ready yet. There you go. The health and economic consequences of COVID-19 pandemic have disproportionately affected the Latinx community. Across many states, Latinx populations have contracted the virus at about twice the rate of the population proportion. In LA County, for example, Latinx people represented over 70% of those individuals hospitalized for COVID-19 related illnesses in safety net hospitals such as the one I work at here in the northern part of the San Fernando Valley, Olive View UCLA Medical Center. And within the Latinx community, specifically in the population I think doesn't get as much focus, but since I work in this area, I do. Those with serious mental disorders like schizophrenia, bipolar disorder, major depression are even more susceptible to virus exposure due to their cognitive impairments, their lower awareness of risk, and the barriers to adequate infection control, including the fact that many live in congregate living areas. So as a psychiatrist working in a community mental health center, as soon as the COVID problem came aboard, the first thing I thought of is how do we help our patients, the ones with serious and persistent mental disorders, cope with all the struggles that everyone else is dealing with, but even more so because of their limited resources associated with their mental disorder. Let's go to the next slide, Blanca. So I started looking in the literature regarding what is the risk of COVID-19 specifically among seriously mentally ill people. Okay, and luckily there were a few researchers looking into this area. One very early, like in around April or May of 2020, was Shi, Campbell, and Zhang, who really identified the problem of working memory deficits. Those are the ability to think ahead, to plan, to really understand what's going on around you. And these authors postulated that those working memory deficits, which are very common in individuals with psychotic disorders, would likely put them in extreme risk. So, for example, they might not be able to think about adhering to distancing protocols. And, for example, wearing masks on a regular basis. All those sort of things would put them even more at risk for spreading the virus. So that article really got people thinking about, let's look at the data as it comes available in the early months of the pandemic and see if there's a higher risk for individuals with serious mental disorders. And needless to say, pretty soon thereafter, in the summer of 2020, already some studies started coming out. One was by Nora Volkov and her group at NIDA. We're actually looking at this by looking at, and this is the Wang, Zhu, and Volkov study. In that group, what they looked at was a large electronic database that included 60 million adults, including almost 1 million people of Latinx heritage. And they found a 7-time increased risk of infection and a 2-time risk of mortality for those individuals diagnosed with schizophrenia. So even within the population, Latin or whatever the case may be, the risk was much higher for individuals with serious mental disorders than not. Now, this finding of the increased risk in people with schizophrenia has now been replicated several times. As you can see, Lee et al. In a Korean sample found a 25% increased risk of mortality among people with schizophrenia. Fond et al. In a French sample late in 2020 found a 3 times higher risk of mortality in individuals with schizophrenia. They were looking at over 50,000 patients who had been admitted to hospitals, and they found this with people with schizophrenia. And then back here in the United States, Nimani and colleagues in New York, who had a study of over 7,000 people who were laboratory confirmed COVID-19 within the New York public health system, they found that a schizophrenia spectrum diagnosis was associated with a 2.67 times higher risk of mortality, almost 3 times higher rates of mortality among people with schizophrenia than people that did not have a serious mental disorders. But interestingly about this, they actually looked at people with depression and anxiety and did not find increased rates in those two diagnoses. It was limited to individuals with psychotic disorders. And then finally, we have a study in early 2021 in an Israeli sample that looked at over 50,000 patients and found that people with schizophrenia had a 2 times higher risk of hospitalization and a 3 times higher risk of mortality. So in other words, our suspicions were correct that people with schizophrenia and psychotic disorders are at higher risk for COVID-19 and therefore require special measures to try to address their concerns. Let's go to the next one. Okay. So now looking at the concerns, I also thought it'd be important to know, what about what people with these illnesses, what do they think regarding COVID-19? How are they worried about it and what are they doing about it? So fortunately, there was a study that was done in late 2020 by Costa and colleagues, which Costa was able to get access to data from an online peer support group that had over 18,000 participants. No, you can go back. There you go. 18,000 participants that included people with self-reported schizophrenia, and it suggested that the patient's concerns about the pandemic and what would happen are kind of the same things we would be worried about, right? Disruption of services, not being able to get to their doctors or to their clinics, running out of medications because they can't see their doctor or can't get to the pharmacy. And then interestingly enough, social isolation, feeling like they'd be left to their own devices and not be able to connect with others, which many people find very, very important, especially those with serious mental disorders. So this is some of the data that we had about what we thought would be worth understanding about. Let's go to the next one. So the next series of slides that I'm going to show you has to do, and again, this may be data that you saw earlier today. I don't know whether Dr. Aguilar Gaxiola presented this, but this is just to go back to the Latinx community and show you that all the things you've been hearing about that Marta talked about have actually borne out. I'm going to show you 4 slides that were developed in early 2021 by David Hayes Bautista and his group at UCLA, which showed essentially what we've all expected, which, and by the way, the title of his white paper that came out a couple months ago was COVID-19 Burned Through California's Latino Population. And it certainly did. So I'm going to show you 4 slides very quickly, and the difference between these slides are essentially what age group we're looking at. So right now we're looking at the risk of COVID-19 in Latinx communities amongst people 80 years and older. And I'm sure you're not surprised to see the yellow bars represent people of Latinx population, and the other one is non-Hispanic white. And as you can see here, over a 2-fold increase amongst people 80 years and older, where the individual's death rates was twice as high in Latinx populations than in non-Latinx population. Let's go to the next slide, and you'll see that if we look at a little younger, between 65 and 79, the problem is even worse in terms of the difference between the yellow bars and the blue bars is now about 4 or 5 times higher death rates amongst Latinx people versus non-Latinx people. And if you go to the next slide, we're going younger again. Blanca. There you go. Between ages 50 and 64, look at how dramatic the differences are between the yellow bars and the blue bars. Like 6 or 7 times higher rates of death in people between 50 and 64 for Latinx population compared to non-Hispanic whites. And these numbers will kind of hold. If you go to the next slide, Blanca, again, 35 to 49 years of age, same thing. Huge differences in death rates amongst people who are of this age, if they're Latinx versus if they're not. So again, I'm sure some of this data was presented, but I just wanted to make the case. Why is it important to focus on people with schizophrenia? Because they have higher rates of developing this disorder and dying from it. Why is it important to focus on Latinx? For the same reasons. So you can imagine if you put the 2 things together, Latinx populations with a serious mental disorder, that's even exponentially more important to focus on that group. Next slide. Oh, I'm sorry, it's the same one, the 18 to 34, again, a difference of about 5 times between Latinx versus non-Hispanic white. Go ahead. Okay, so the rationale for the project I'm going to tell you about and the preliminary work that we've done on it. So first, let me start with the rationale. So given their greater likelihood to the exposure of the virus and the increased risk of contracting or becoming ill from the virus, it seemed to me that efforts targeted to the Latinx population within the seriously mentally ill should focus on increasing knowledge and safe practices associated with COVID-19. Over the past 15 years, my colleague, Steve Lopez, who I mentioned in the beginning of this talk, and his team have developed and tested novel and creative Spanish language informational communicational resources using a storytelling format to teach individuals about psychosis using everyday language and images and songs drawn from Latino and Mexican popular culture. Each media format applies an acronym and mnemonic device that reflects the key symptoms of the disorder. So for example, we did one that was based on psychosis and we called it La Clave. La Clave because the letters of clave, C-L-A-V-E, each letter stands for a different psychotic symptom. Like C would be creencia falsa or delusion. L would be lenguaje desordenado or thought disorganization, et cetera, et cetera. So we've been able to find these sorry, we're flipping back. Here we go. We've been able to find that these techniques that we've used to educate the public and people with serious mental disorders to be effective in increasing the mental health literacy of Spanish-speaking communities in California as well as in Puebla, Mexico. We've actually tested a couple of the videos that you can see on the website called www.uselaclave.com. And you can go to that website and see by scrolling down and clicking on La Clave a little bit about our work. So this is a bit of a commercial, but I'm just letting you know that there is resources that we've used over the years to help the public understand more about psychosis. And we wanted to build on that work by being able to do what I'm going to tell you about this morning. So Steve actually was approached by a group of people in Kern County early in 2020 regarding how to get the word out. They had known about our La Clave project and our psychosis education, and they wanted us to educate the community about COVID. So when COVID hit the U.S., our team was asked to develop an initiative to address the psychological distress that the Spanish-speaking community was facing, specifically in Kern County. So in contrast to the web-based messaging that are largely text-based, we chose to develop a radio-based platform. And so we drew on our prior endeavors with regard to mental health literacy, and we embedded the key message within certain narratives. In this case, they were 60-second mini stories. And once again, you can see these, or you can hear the radio stories if you go to the uselaclave.com website. But basically, we would have this story in which a family or friend would call a woman named Doña Esperanza. And Doña Esperanza was a wise old woman in the community, and they would call her because they were saddened by the loss of their job, they were worried about their future, they were upset about not being able to see their relatives. And Doña Esperanza in these radio ads would offer wise counsel and drawing on principles, particularly of behavioral activation. We chose behavioral activation because we thought it was clear, straightforward, and behaviorally oriented. And although it's been used to treat depressive disorders, our goal was to use behavioral activation to persuade people who were experiencing psychological distress to take steps to improve their well-being. We found that the Spanish radio spots, which played for several months in 2020 in Bakersfield, California, significantly increased web traffic. In other words, people would come to our uselaclave.com site and learn about what they could do about COVID-19, et cetera. And like I said, if you want to look at listen to those radio ads, you can go to the COVID-19 tab within the uselaclave.com website. Anyway, next slide, Blanca. So the specific aim of this project I'm going to tell you about today was to carry out a sustainable, internet-based communication initiative to increase the COVID-19 knowledge and safe practices of particularly vulnerable Spanish-speaking adults in LA County. So to do this, we actually got a grant from the UCLA David Geffen School of Medicine. They had a special funding ability called for COVID-19 research awards that had sort of an expedited review process. And when I say expedited in academia, from the time I applied for it in July, I got it in October. So I know that might sound like a long time for you, especially in the middle of a pandemic, but in academic time, 3 months is like a flash, like the speed of light. So we were able to get that award funded in October 2020 and be able to begin our project. Go ahead. So I'm going to describe the various project steps. So to address the specific aim I just brought up, we propose to carry out 3 specific activities, each with specific milestones. First was to refine the COVID-19 section of our La Clave website by creating a short audio-visual fotonovela to demonstrate safe practices during the COVID-19 pandemic. Then we were going to present the material, this newly developed material, on an e-learning platform to individuals with schizophrenia spectrum disorders within the Spanish-speaking Latinx community, particularly in our area, in our community mental health center, and working at all of you, we have a large population of Latinx patients who come to get our services. And finally, we wanted to evaluate, as Luis was talking about earlier, the importance of data to see that do these interventions that we plan, do they work? Do they help? So the plan is to evaluate the effects of the intervention using a randomized controlled trial to determine if we can actually change people's knowledge, attitudes, and safe practices associated with COVID-19. Okay. Let's go to the next one. Now, many of you may not have heard of fotonovelas, but this is an interesting process. We chose to use health-related fotonovelas because they differ from common patient education materials, such as brochures and informational pamphlets, in that they incorporate popular images, cultural norms, simple text, dramatic stories, and vivid pictures to engage Latino audiences and raise their awareness about health issues, health promotion, and even to combat stigma. The uniqueness of fotonovelas as a culturally informed health literacy tool is that it embeds engaging visual elements and educational messages within the context of an entertaining, dramatic story that portrays characters in common everyday situations that the targeted audience can identify with. So I actually reached out to the USC School of Pharmacy. My colleague Steve Lopez knew about a group there led by a really wonderful individual named Greg Molina, who works at that School of Pharmacy and has produced numerous audio-visual fotonovelas used throughout the world to improve health literacy among underserved populations. They've done fotonovelas on asthma, dementia, diabetes, and obesity. And they have a number of publications on these fotonovelas and their efficacy. Some of them were led by another colleague of mine, Leo Cabasa, who's now in Washington University in St. Louis. But others, as you can see, some of the references down at the bottom of the slide are some published articles. So if you are interested in learning more about the fotonovelas, you can read about them in these various articles. Let's go to the next slide. I'm aware that not everybody has access to all this information, so I wanted to make sure you could at least see what these fotonovelas look like. So what I'm showing you here is one typical one, which they titled Sentimientos Secretos, which uses a unique culturally adapted depression fotonovela. In English, it was Secret Feelings, and it was developed by Cabasa, Greg Molina, and Melvin Barron. That's the group from USC School of Pharmacy. And it basically, as you can tell, it has a popular comic book style pamphlet. It portrays a dramatic story using photographs and dialogue bubbles, and it's become an effective tool for engaging Hispanic audiences and increasing knowledge about specific health issues. They're designed to enhance the awareness and understanding of depression, its role in chronic disease, and its impact on Hispanic populations, as well as a multitude of barriers to effective treatment. These fotonovelas are created in both English and Spanish. They actually flip upside down, so the same document, you can read it in Spanish or in English, and you can use it in the presence of family members or loved ones if desired. So this is just one example. I want to blow it up a little bit. So if you look inside one of these fotonovelas, let's go to the next slide. These are the dialogue bubbles I was talking about. So this is what a fotonovela looks like. You open it up and you'll see a scene, like for example, in this case, there's a doctor talking to a patient, and you can see that the dialogue goes, you know, Dr. Robles asks Sophia various questions about how she's been feeling and determines that she's depressed. And then you can see what it is that Dr. Robles is asking. What have you been experiencing? The lack of energy and motivation, problems sleeping and crying more than usual are symptoms of depression. I'm depressed? How did this happen? So I won't read the whole thing, but this is what most of these fotonovelas look like. And so our plan was to develop a fotonovela focused on COVID-19. That was what we wanted to do at first. Okay, let's go to the next slide. Now, after several meetings with the group, with Greg Molina, Steve Lopez, myself, and some of his really creative people at their program, we settled on a particular theme for the fotonovela, sort of a message that we can get through. And I actually found this message on the Orange County Healthcare Agency. So if anybody has seen this before, I found it online or in the Orange County website. And I obtained the permission of Orange County to use this idea. To tell you the truth, the health director there was absolutely delighted that we wanted to use it because they developed it for the purposes of sharing it with others. So they were glad that we were going to do that. So our theme, and you'll see in a minute, is cara, manos, and pies. That was the basis of the fotonovela. Cara, is to use cobertura para la cara, use a mask for your face. Lávase las manos con frecuencia, wash your hands, often. And then mantenga una distancia de 6 pies. Maintain 6 feet distance from each other. That those 3 steps, if we can just hammer home those points, that would be important for patients to learn about and to use. You really want to focus on those problems with working memory and trying to make sure that they understand what the specific issues are that we want to depict. So we got the screenplay written, the actors were identified, and we were ready to roll. But we ran into a problem. Because of the limitations of the pandemic on face-to-face contact during professional entertainment productions, we had to make some last-minute adjustments. So in late December, right when we were about to go into production with photographing and making one of those fotonovelas, we had that big wave of COVID-19, the viruses, and the hospitals were full, and a lot of really difficult time period. So even though we had originally planned to photograph the depicted scenes, we couldn't because we couldn't get a production company that'd be willing to do the photographing, because you have to put people together with scenes of a mother and a son and that sort of thing. So what we decided to do really quickly was to illustrate the scenes, and meaning draw them. So we found a really talented graphic novelist named Luc Lizaldi. Luc is an amazing guy. He's done a lot of graphic novels that are really kind of cool, and he sent us some examples of his work, and we worked with him quite a bit to develop a story based on Cara, Manos, Pies, and he was working really hard over the last several months as we went back and forth, what's the best way to do it? And I'm really happy to say that just last week, Luc finished the project, and I want to show it to you guys before I even do it on, for a research project, because it just is hot off the presses. We're hoping to do the research soon, and I'll tell you about that after the video. But Blanca, do you think you could cue up the video?
She's trying to put the video, Alex.
Okay. It's a 9-minute video, and this is what we plan on showing our patients and their families, hopefully to learn something about COVID-19.
Okay.
Is working with some technical, is coming right now. Alex, can you continue? She's looking the way in order to put it on, and maybe give me 2 minutes, and we will try to do it.
Okay, like I said, this is the point where I wanted to present the slides, present the video, because after that I'll be talking about the measures, but I can talk about the measures if you want.
Yeah, please.
Okay. So let me see if I can share my screen.
Okay, can you do that? You share your screen?
Yeah.
Excellent.
I hope so. I don't see it right now.
I see your presentation right now. But
You do?
Yeah, but I don't know where is the video.
Okay, but you see the slide that says study measures?
Yeah, correct.
Okay, good. All right, so I can tell you a little bit about this. I was planning on showing you these slides after the video, but this is to give you an idea of what we're going to be doing. Once we show this video to our patients, then we will collect data of what at baseline before they see the video, 1 month later, and 3 months later for a total of 3 time points. And what we're going to be asking them is, well, of course, the obvious demographic variables, like their age, gender, marital status, educational level, and working status. We'll also be asking them about acculturation level. The video, as you're going to see, is in Spanish, so we want to make sure that they speak Spanish fluently. And then we're going to be asking them as well, just to make sure you're seeing the same slide, we're going to be asking them about the knowledge, attitudes, and behaviors that use the instruments from the COVID-19 survey. NIH developed their own survey instrument that we use across different research in the country, funded by NIH. So they'll be translated into Spanish, and people will be asked questions like, for example, which one of the following are symptoms of COVID-19? Just to see if they learn that from the video. Then we're going to ask them about their attitudes. Did watching the video change how likely they are to wear a mask on a daily basis? Okay, are we getting close? All right, let me stop there and let the video go.
Otra mañana estresante en la casa de los Martínez durante la pandemia. No dejes que el COVID arruine tu día. Quédate adentro.
¡Mijos, levántense! Buenos días. Levántense ya.
No. ¿Por qué no puedo quedarme en la cama para ir a la escuela en la computadora?
Para que tengas orgullo de ti mismo y de tu trabajo.
Pero Víctor está en pijama.
Mis clases están pregrabadas. Mamá, no me hagas desayuno. Tengo que irme a trabajo más temprano.
Pero estás trabajando mucho y no te estás cuidando. Necesitas comer un buen desayuno o te vas a enfermar. Jennifer, mija, levántate.
No, estaba teniendo un hermoso sueño que había regresado a la escuela y estaba con todos mis amigos.
Mónica hace el desayuno para sus hijos.
Jennifer, Juanito, prendan la computadora y el iPad para empezar sus clases. Esta vez de verdad. No pueden engañarme.
Mónica prepara burritos para su trabajo haciendo almuerzos para entregar. Doña Esperanza viene de visita.
Buenos días, comadre. Buenos días. Tengo todos los burritos listos para llevar a los trabajadores del hospital.
¿Trabajan tan duro? Es lo menos que puedo hacer ahora que me retiré de enfermería y puedo ayudar de esta manera.
Buenos días, madrina.
Víctor está a punto de abrazar a Doña Esperanza, pero ella le pone el codo.
¿Dónde está tu cubrebocas?
No lo encuentro.
Ve a tu cuarto y encuéntralo.
Ya no tengo más.
Entonces te traeré uno nuevo.
Se me hace tarde para el trabajo y no es gran cosa.
¡Claro que es gran cosa! ¡Te puedes morir!
Por favor, mamá. Estás exagerando. Nos vemos al rato.
¡Víctor! ¡Ven para acá! No me dejes hablando como loca.
Cuando mi hijo cumplió 18 años, pensaba que sabía todo y no quería que le dijera qué hacer.
Me preocupo mucho por él. Ha estado trabajando en 2 lugares y tomando clases en colegio comunitario, que actúa como si no existiera la pandemia.
¿Quieres que hable con él?
Puede que no me escuche a mí, pero tal vez escuche a su madrina.
Esa misma noche, Víctor regresa del trabajo y recibe una llamada.
Linda, perdóname que no he podido llamarte.
Ah, Víctor, no tienes tiempo para mí.
Tengo 2 trabajos para ayudar a mi familia. Y con todas mis clases y deberes.
Lo sé, pero te extraño y no sé por qué ya no podemos vernos.
Mi madre no quiere que nadie entre a la casa. Mi padre murió de pulmonía hace años. Por eso tiene miedo que alguien de nosotros se vaya a morir.
Bueno, entonces vamos a terminar por ahora y cuando la pandemia haya terminado podemos ver si queremos vernos de nuevo.
¿Qué? ¿Y si nunca se termina? Mi vida es un desastre. Trabajo, trabajo, trabajo. Estudio, estudio, estudio. Y esta pandemia me está volviendo loco. No tengo ni privacidad y ahora ni novia.
Juanito sale de debajo de la cama.
¡Ey! Y dices que yo soy el dramático.
¿Escuchaste mi conversación?
No hay privacidad, así que aquí es donde me escondo.
Ve a esconderte en otro lugar.
No, este es mi cuarto también.
¡Fuera de aquí!
¡No! ¡Mamá!
Mónica entra corriendo.
¿Qué está pasando?
Está actuando raro y quiere echarme en mi cuarto.
Juanito, por favor, vete a la sala.
Pero Jennifer está ahí, haciendo sus ejercicios para su clase de educación física.
Déjame encargarme de esto.
Pero quiero ver que lo castigues.
Tengo 18 años. Ya soy un adulto. Así que ella no puede.
Mijo, tienes razón. No puedo obligarte a hacer nada. Pero tienes que calmarte. Hijo, todo esto pasará.
Víctor ve su celular, recibe un texto y lo contesta.
No puedo hablar ahora. Otra persona se enfermó y me necesitan en el trabajo. Me tengo que ir ahora.
Pero no descansaste. Ven, te compré otro cubrebocas. Tienes que ponértelo. Tienes que lavarte las manos ahora y cuando llegues al trabajo. Y tienes que mantener distanciamiento social.
No, lo necesito.
Necesitas usar un cubrebocas, especialmente si los empleados están enfermando.
Es solo porque nos sobrecargan de trabajo.
Necesitamos que te cuides, porque puedes enfermarnos a todos. Y podemos morir, igual que tu papá que trabajó demasiado.
Mamá, por favor, no me chantajees. Tengo que irme.
A la mañana siguiente, doña Esperanza ve a Víctor solo en su carro.
Buenos días. ¿Estás bien, Víctor?
No, me despidieron del trabajo porque no quería usar un cubrebocas.
Mi pobre hijo Raúl se enfermó de COVID porque no quería usar un cubrebocas y casi se muere.
¿Raúl? Pero es un jugador de fútbol y está fuerte.
Sí, pero no tuvo cuidado y su trabajo no cumplió con el método cara, manos y pies.
¿Método cara, manos y pies?
Usa un cubrebocas en tu cara para protegerte del virus. Lávate las manos para evitar contagiar a otros. Y mueve los pies para tener 6 pies de distancia social para que nadie te lo pegue.
Víctor considera su propuesta.
Supongo que tengo que tener cuidado.
Estaba tan asustada. Pensé que perdería a mi hijo. Estuvo en el hospital más de un mes Cuando lo ingresamos al hospital, mi familia tuvo que ponerse en cuarentena durante 2 semanas. Víctor, tu madre te ama.
Sí, tienes razón.
Adentro de la casa de los Martínez, Mónica, Juanito y Jennifer desayunan.
Buenos días, comadre.
Buenos días. Todos los sándwiches están listos.
Gracias. Mónica, Víctor y yo ya platicamos.
Mamá, ya entiendo que no quieres controlarme. Solamente no quieres que me pase lo que le pasó a Raúl.
Todo lo que una madre quiere es lo mejor para sus hijos. Tu salud y felicidad son importantes para mí.
Sí, ahora lo entiendo. Cara, manos y pies. Y todos estaremos más seguros.
Sí, mijo. Todos tenemos que hacer nuestra parte.
¡Viene una vacuna!
¡Wow! ¡Una vacuna!
Sí, ya quiero que se termine esto. Si no, nunca voy a tener novia.
Bueno, al menos estamos todos juntos y sanos.
Cara, manos y pies son importantes, pero asegúrense conseguir la vacuna para protegerse a sí mismo y a su familia.
¡Manos! ¡Yes!
Okay, so this, as I told you guys, this is hot off the press, and I know there's some interest. I saw some chats about asking for the link. We can't do it yet because we have to use it for our research project, but it will be available in 1 month off the www.uselaclave.com website. You could go to that 1 month from now and be able to download it. I apologize, I cannot share it until the research gets done because we're going to have half of the patients are going to be seeing it and half of the patients are not, so we can see the efficacy of the treatment. So I apologize for that. I didn't want to just tease you with this, but we really were so excited about it. I wanted folks to get an idea and can give me feedback if they wish. And as I said, I promise, so Blanca is not going to be able to share this with you, but you can get it off the website in about 1 month. Okay, so let me go back to the slides for a second. Blanca, you want me to use my screen or you want to put I think you have the screen, just go up a few slides.
Alex, if that's easy for you to use your screen, go ahead, that's fine. You can share your screen, no problem.
Okay. Let me make sure I got the right one.
You got it. Thank you.
Are you seeing the slide that says COVID-19 knowledge, attitudes, and behaviors?
Yes.
Okay. So this is where I left off. I was telling you that at the end of the video, we're going to be asking patients about their knowledge, their attitudes, and their behaviors. And an example of the attitudes, that's where I left off, is, how likely do you think that the following events will happen in light of the current 19 pandemic? That you will be affected, that someone in your family will be infected, that you will be quarantined, or like you see here, how likely are you to wear a mask? And then we're going to ask people about their behaviors, specifically what they did over the last week before we go back and call them a month from after they watched the video. So an example would be, over the past week, how often have you worn a mask or maintained 6 feet of distance or avoided contact with people at high risk? Or now that we've adjusted, have you been vaccinated? Right? So that's something that we're going to be taking a look at to see. Unfortunately, we don't have a lot of good data yet on the base rates at which people are getting vaccinated in the Latin schizophrenia population. But we will have the data when we do this study, because we're planning on actually studying over 100 people with schizophrenia to see what the effect of this video will be. Let me go to the next slide. And just to give you an idea of what the study hypotheses are, after we give half the people watch the video, half do not, we expect that those who were exposed to this video that you just watched, this fotonovela, will have a greater knowledge, will have more realistic attitudes, and will have safer behaviors than the control subjects. And I'm hoping that Luis puts together another conference in about 6 months or a year, and I'll be able to present the results of this study, and hopefully it won't be by video, by Zoom, it'll be in person. Whenever we find a place to do it,
Alex.
Anyway, that's the end of my presentation. Thank you very much for your attention, and I'd be more than glad to take any questions.
Okay, so thank you, Alex. Thank you so much. I think it's wonderful, and also the partnership with Steve is amazing. I know that even he used La Clave before, probably around 10 years ago, and he used some songs, some canciones with some from Maná, talk about, when to reduce stigma, but also to do awareness about mental health in our community. And I think it was amazing when he shared with me, the canciones that he used with the Spanish community, and also in Bakersfield used the radio bilingual, which is they have a huge cover in the whole Kirk County. So that's excellent. Anyway, so how about any questions for Dr. Kapelowicz? We're open. I have, again, I see in the chat one regarding, again, I think the difference is right now what people with severe diagnosis, like you say, this is bipolar disorder, schizophrenia, and they come with comorbidity issues now, meaning physical issues and also some substance abuse issues. And the risk, I assume, is higher, Alex, when we have these people with comorbidities, can be obesity, can be diabetes, hypertension, and also substance abuse. Do you have any simple the study, some of these one with comorbidities in order to see how higher can be the risk?
Yes. Well, like I said, we're going to be recruiting people from the clinic and from the hospital. And like you said, a lot of them have comorbidities, whether it's medical or substance abuse. So that it's not an exclusion factor. We're just taking 100 patients with these illnesses, and whatever they bring to the table, we'll be including them in the population as well.
Excellent. I think another question for the chat is the vaccine for these people. Sometimes they don't have the ability in order to go before long lines. Now I think we have a better situation with a lot of centers open. Any improve regarding this, not only people with, chronic diagnosis, but in order to improve the vaccine for them, because the emphasis is in the vaccine, of course. And I think that the video is a very well done, very realistic. I think I like the language, very, practical for people, they can understand, nothing about the language is easy to understand even for familias and especially essential workers and also farm workers. So they're very well done. So any comment, Alex?
Well, we obviously emphasized we wanted to do this with a very basic language. The woman who wrote the screenplay was the same woman who did Real Women Have Curves. So she's a really talented screenplayer and really fantastic. We've worked with her before in our La Clave movie also. So she really understands how to communicate to this population, and I think she did a good job with doing that. With regard to the vaccine, we're stepping up our efforts. So, for example, in the hospital, if patients are in the emergency room or in the inpatient unit, we offer them the vaccine, including the Johnson & Johnson, the one-shot vaccine, so that they can get access to it. And we've been doing that quite a bit. When the clinics open up again, we plan on doing the same thing.
Excellent. Again, thank you so much, Alice, for always making the time from your busy schedule. I really appreciate that. Amazing work, excellent work with all the partnership with Steve and other ones. So I plan to take your word regarding put together another conference maybe in 6 months and 1 year, so you can show to us, this outcome, because it's so important, especially right now that inequalities across the country, not only with Latinos, but people of color, is still there. I think there's a lot of work to do, especially with access, clinical care, quality care, integrated care, and family participation. So really appreciate, thank you so much, Senor, and we talk later on.
Thank you.
For the rest of the audience, I have few announcements. Number one, we will send all the presentations to everybody, including Dr. Sergio Aguilar Gaxiola. Again, the link for the video, Alex said, planning to be available next month. Also, we're planning to send you a certificate of attendance. I know some counties, they have this cultural responsive training, and I reviewed the whole program. I think they qualify for cultural responsive training, but your agency has the last word in order to approve if this is something that this training will be approved by your own agency. I want to thank everyone. We'll continue support. I see a lot of good friends, good colleagues that they working so hard in the system for the last 10, 20, 30 years. Tere Chapa, Laura Span Bonito, many other people. So again, thank you so much. Have a good afternoon. God bless you all. Oh, take care. Teresa, you have a question?
Just thank you so much, Luis and team, everybody, for doing this. We need more of this. It's not just the information, it's bringing us together, feeling like family, sharing. I just want to thank you from the bottom of my heart. Mil gracias, Luis y el equipo. And let's keep it up.
Remember, I think for everyone, we are familia.
Somos familia.
La cultura cura. A lot of protective factors. And Laurita Span, un gusto, that you are with us. You want to say something?
No.
No. Okay. Well, again, thank you so much. God bless you all. Take care. Bye-bye.